Hey guys, welcome to the Hypertrophy Hub podcast. So this week I had the pleasure of speaking to Martin Refalo. So me and Martin have done a few podcasts before, but the other week I attended his seminar talking about sort of female fat loss and female physiology and female fat loss.
Uh-huh.
And I
That's
think it
right.
was really, really cool because for me, it was kind of the stuff I had, like the reason I wanted to attend was like, okay, I had basically no clue about any of that stuff. Like I kind of have a grasp on like how to get people to lose weight, kind of. And it's like, these are just areas that I don't know much about, but I know they're influential. But I didn't quite know why or what or how. So Martin, would you be able to outline kind of why should we care about female physiology
Mm,
and what differentiates it? Why does it matter in terms of
yeah.
fat loss, muscle gain, etc.?
Mm. Well, thanks for having me on again, James. As
My
always, a
pleasure.
privilege to be here. And like you mentioned, I did run a female fat loss and physiology seminar last week. And I do want to preface this conversation by saying that this topic is quite a nuanced topic, and I think coaches can really benefit from understanding it, even on a basic level. I think that can help you from not falling into the trap of treating females the same way you would males throughout the coaching process. I know this is a trap that I fell into in my early stages of coaching. And don't get me wrong, I still got good results with my clients, and you still can get good results with your clients, whilst disregarding a lot of these things. Because remember, the nutrition and training principles do stand their ground universally, no matter the gender. So as long as you apply them, you will get great results with your clients. But if you do want to become, a high level coach, and what I mean by that is just coaching clients other than the general population, like, if you want to coach a female client into bodybuilding prep, or just a female high level athlete in general, understanding the differences between males and females and the implications that can have on training and nutrition is super important. Also, it's very easy to fall into the trap of reading something online. Like, for example, you might come across something that says, progesterone has all around negative effects. And then you might link that to the fact that progesterone goes up at certain periods of the month. And a lot of coaches, and I have experienced this or seen this in the past, overhaul their training programming based on that information, that one point data point, essentially. And that's another thing that I think understanding these differences on a basic level can prevent you from doing. Okay, because we don't want to overhaul our philosophy based on what we know about males and females and the differences, but we need to be able to mold our understanding into our philosophy, making sure we're not violating any of the principles, just making minor changes that I do think can be effective, specifically for females. So, like I said, early on in my coaching career, I kind of disregarded these things. As my female client base increased over time, I took it upon myself to learn more about the topic. And you asked about the magnitude of effect,
Mm.
how large are these differences? And the thing is, females are quite capable when it comes to building strength and gaining muscle, just like males are. There does seem to be a slight misconception surrounding a female's ability to build muscle and strength. And if you look at a lot of the research, the relative gains that females experience throughout their training career are very similar to that of a male's, okay, on an absolute level, because a male starts with a larger amount of muscle mass and thus more strength. They will generally, on average, build more absolute strength and hypertrophy. But if you look at a female, she can still build she can still achieve relative gains that are equivalent of a male. So in saying all that, the physiological differences that arise between males and females are due to the menstrual cycle. Generally, that's the primary reason that physiological differences arise, and then because of that, hormone levels change, and that's what influences the differences in the training and potentially the nutrition response between males and females. So that's what I mean when I say we need to understand these differences. It's what's happening on a hormonal level in a female, within a female, that may have implications for their training and nutrition programming. And if you are working with a high level client, So a female who does want to compete, potentially in powerlifting, bodybuilding, or any other sport, manipulating your training and nutrition to align with those differences in the long run, I think can be effective. For general population clients, it's very questionable whether or not you should be placing a large emphasis on those differences, because the training and nutrition principles are obviously the big picture things that we need to be worrying about here, and they will lead to some awesome results. But like I said, when you want to take that step further, become more of a high-level coach, paying attention to the physiological differences becomes increasingly important. And that's what I've found myself transitioning into over the past 2 or so years. And I feel like what the strategies that I've come up with based on what I've seen in the research, based on the trends that I've observed with my clients, have been somewhat effective. Obviously, it's very hard to measure that, but if your clients are progressing really well, then I guess that's a plus, that's a positive, and you keep doing what you're doing.
Yeah, and I think like when I first saw sort of you talking about this stuff, like I think the first thing I saw was your IGTV video, I think on the JPS page, where you talked about like just that idea, like, oh, females can still gain a pretty, like, if you look at it in terms of like how much muscle they've actually gained, it's pretty similar. Like it's not this massive discrepancy that we make it out to be. And I think it's really cool, because it's like a lot of fitness tends to be like male centric. Like I've had a few comments from people being like, why don't you get more females on? Why don't you get this? Why don't you get that? Why don't you focus on female physiology? And it's like, I don't understand it. So it's like,
yeah, right.
I can't dive into it, but yeah. So I think it's a really useful topic. Like I've had a few conversations with people afterwards, and I was like, wow, like there's so much of this that I still don't like. Even watching it, I was like, damn, there's so much here. Like I remember the amount of notes that I wrote. I was like,
yeah, I saw that.
It was massive, and I was just like, shit, it was fantastic. So should we dive into that? What's going on with the menstrual cycle? How does that affect things? Yeah. So what does that whole picture look like?
Yeah, so when I first started learning about this, I had a very similar feeling to you. Not necessarily an overwhelming feeling, but I was exposed to the complexity of the human body, and that was the purpose of that presentation that I hosted last week. So the menstrual cycle is very complex, it's very intricate, and it really does highlight how much we don't know about the human body and about physiology and its ever-changing nature. So if we just briefly overview the menstrual cycle, because obviously that's really important before speaking about programming implications. Generally, a cycle will last 28 days, but there is no normal cycle, which I think is important to mention. So a cycle may last anywhere in between 20 to 30 plus days, but on average, it's going to be that 28 mark that we're speaking about. Now, if we zoom out slightly, we can see that there are two phases of the menstrual cycle. Okay, so we've got a follicular phase, we've got a luteal phase, and right in the middle, we have what we call ovulation. So we don't really need to understand, we don't need to dive too deep into the weeds here. We just need to understand that across the two phases, there is essentially a different hormonal environment. Okay, so early on in the follicular phase, we have what's called, we can say there's a sub-phase called menses. That's where females menstruate. And that marks the start of the cycle. And from then onwards, we get these large changes in estrogen, which is one of the main reproductive hormones within a female. And then in the luteal phase, we get this large surge in progesterone, which is the secondary reproductive hormone of a female. Now, the thing is, these two main hormones, they come with different properties, you could say. And these properties can influence or can have a widespread effect on how a female is feeling, how she is performing in the gym, her hunger levels, cravings, a whole host of different areas in the body or systems in the body can be influenced by these hormones. And like I said earlier, those are the main differences between a female's physiological environment and a male's. So if you look at a male, They still produce some estrogen, some progesterone, but it's nowhere near compared to a female. And a male's hormonal environment over the course of the month is going to be very stable. Okay, testosterone doesn't really change too much unless it's influenced by certain factors like excessive alcohol, being overweight, sleep deprivation, etc. On average, testosterone is going to be flatline throughout the whole month. But then if you look at a female, the hormones are going up, they're going down, they're fluctuating quite drastically based on certain time points throughout the month. Now, if we take a step back, I did mention estrogen was the primary reproductive hormone. And like I said, its effects are quite distinct, quite different to progesterone's effects. So estrogen actually has many positive effects on the body, unlike what it is usually made out to be. Okay, so I've seen many Instagram posts. Instagram is the perfect place for these things that portray estrogen under a negative light. Okay, so because estrogen does have some effects on body fat patterning, generally in the lower body in females, that's where they hold most body fat. Many people then take that and say, estrogen leads to fat gain, which means we need to really make an effort to kind of decrease and an influence and make sure it doesn't go up. That's a flawed way of thinking. Okay, so like I said, there are many positives, particularly when it comes to training. So, for example, estrogen has what we can say is an inotropic effect, and that means that it can influence force of muscular contractions, generally through neural output. So there is mechanistic research that shows estrogen can increase, has a net positive excitatory effect on the nervous system, which means that you're just able to have a larger neural output when estrogen is high compared to when progesterone is high. And progesterone, interestingly, actually blunts many of estrogen's positive effects. Okay, so it really is progesterone, which is the hormone that leads to a lot of the negative complications that females feel throughout a menstrual cycle. So it's important to make that distinction. Estrogen on average has positive effects. Progesterone, on the other hand, does lend itself more towards the negative side of things. Okay, and what I mean by that is progesterone will generally decrease anabolism, so muscle protein synthesis, can affect recovery, and all this theoretical rationale for these things has direct implications for training programming. Now, if we step forward, so now we have a basic understanding of the menstrual cycle, we understand the hormones. Now, if we look at the research, this is where it gets a little murky. So there is research that aims to elucidate whether there are differences in the training response, between different phases. And there were actually two papers that came out this year. So one measuring changes in strength across the menstrual cycle, one measuring changes in fatigability, which found that the differences between phases are trivial or just very small, essentially insignificant. Now, when you look at that research, it's very important that you view it with a critical eye, because there are lots of limitations, as we know, to research. And when it comes to researching the menstrual cycle, it's important to note that it's a very, very hard, very tricky endeavor. Okay, so for example, in many of these studies, so in these two papers that I spoke about, they were reviews or meta-analyses. So they reviewed numerous single studies or intervention studies. Now, these intervention studies, they don't always measure the actual hormonal environment within a female when they are taking her through this trial. Okay, so how do we actually know for sure that these hormonal changes are occurring? We're just relying on the female saying that this is when I started menstruating, and thus I'm now in the follicular phase. It's very or fairly ambiguous. Also, there are other limitations. So, for example, what was I going to say? So, just lost track of
No
what I was saying.
no stress.
Yeah,
I
that's
feel
all
like
right. So, go for it.
I feel like it seems as though it's very easy for people to um, see like information like this, right, and then very easily overcomplicate or read too much into it or draw too much from it. Like it's like, for instance, the debacle right now about set progression. It's like things like this.
Training
People
volume.
will very quickly, they will like, oh, this is the thing. This is the thing. And I feel like with this, especially, it's like, if you don't understand the magnitude of it, it's like very quick for someone to, I don't know, make up a mesocycle in a way that's completely structured around this, rather than sort of being a supplementing factor.
Yeah. So what I was going to add on top of that is many of these studies, they compare the follicular to the luteal phase, which is fine. But if we wanted to dive a little deeper into the weeds, we could actually split those phases up even further. And we could say that there's an early follicular phase and a late follicular phase. Now, the thing is, the hormonal environment is actually different. Not just between the broad phases, but within the phases themselves. Okay, so for example, in the early follicular phase, when menses is occurring, estrogen is actually quite low, and it only goes up in the late follicular phase. Okay, so if you wanted to set up a research study that investigated differences in the hormonal environment and their implications on training, you would need to split up the menstrual cycle into essentially 5 phases. So early follicular, late follicular, ovulation, early luteal, and late luteal, because the hormonal changes are, as I said, they're all over the place, and they occur not just between the phases, but within the phases as well. And if you look at some trends across the research, we actually see that in menses, okay, there does seem to be a detriment to performance. So when a female is menstruating, and anecdotally, I do see that in a lot of my female clients as well. And then if we look at other trends, one of the main ones that pops out is increases or benefits to performance within the follicular phase in comparison to the luteal. Okay, so we don't see many trends that show improvements in performance in the luteal phase. Most of those trends occur in the follicular phase. So what you need to do with your critical eye is overlay those trends with what you see in your clients, looking out for patterns, and then establishing whether or not it is worth implementing some strategies, okay, that coincide with particular phases of the menstrual cycle with your individual client. Okay, and that the latter part of what I just said there, so individual client, that's really important, because there does seem to be a lot of variance from female to female when it comes to the menstrual cycle. So what we're saying here is what we know to be the case on average, but what occurs on average doesn't necessarily represent individuals themselves. So that is why it's important to, look at your client, assess what is happening over time with that client, potentially tracking the menstrual cycle and looking out for these trends and patterns, trying to overlay them with the research. And then, like I said, coming to a conclusion on whether or not it is worth implementing some changes based on that individual. Because, for example, I have, a handful of clients, female clients, who don't experience many PMS symptoms throughout menses. They don't really present with any complications at any time point throughout the menstrual cycle. And with a client like that, I find it hard pressed to say that we'd need to make major changes to her training program just because she's a female and she still has a menstrual cycle. And that's where it really comes down to you as a coach, understanding your clients, making sure you're tracking these variables over time with that individual client, and being I guess more critical about the way you go about things, as opposed to just looking at the research, seeing that the changes are trivial. That's what the meta-analysis says. So, well, we're not going to do anything about it. We're just going to keep things the same. We're not going to make any changes. I think it's very important to be critical and treat clients on a case-to-case basis, right?
Yeah, I completely agree. I feel like without doing that, I feel like this kind of application would easily become misguided.
Mm.
Like, yeah, and do you personally find like, is there maybe a correlation between the utility of this and how severe someone's sort of menstrual cycle is, like how
Yeah. Yeah.
their PMS symptoms and stuff?
Yeah, totally. So, like most of my like I'd probably say over half my client base now comprises females, and there's a large amount of variance in how they respond throughout the menstrual cycle and how they present to me, and the complications that they say they experience. And it is generally the females who experience more severe PMS symptoms that I tailor these strategies towards. And what I mean when I say tailor these strategies is more auto regulation, light days when needed, deloads potentially at times when they otherwise may not be warranted. And if we look at with these clients, if I anticipate that a client is going to have 1 week throughout the month where they're going to be feeling clumsy, they're not going to be feeling very good, they're going to be feeling fatigued, then to me, I know that I'm going to have to bias their training intensity to a time point in the month where they're actually feeling good, right? And in most cases, that's going to be in the follicular phase. Okay, like I said, on average, that's when a female is going to be feeling her best because progesterone isn't very present, not present at a high concentration. Estrogen is dominant, and generally that will be the late follicular phase after menses. And what I do in that case is I don't overhaul the training program. Like I said earlier, that's probably not a good idea. We don't want to violate any principles. For example, you wouldn't want to just start throwing in additional sets, sets upon sets, and increasing volume abruptly in the follicular phase for the reasons I mentioned earlier. That would just be violating principles, which we don't want to do. Okay, that would be an unwarranted increase in volume. The way I've tackled this in the past and still do is by modulating another variable, which I think can have major benefits on a client's progress, and that's the hypothesis or the concept of effective reps. Okay, and I'm sure you've heard of the concept of effective reps. For any listeners that are currently unsure about what that's referring to, the hypothesis is that as a set approaches momentary muscular failure, so as you get closer and closer to that failure point, the repetitions increase in their hypertrophic stimulation. Okay, the hypertrophic stimulation of those reps goes up. This is because motor unit recruitment is increasing. We've got a decrease in movement velocity, so the muscles are experiencing high forces, high tension. Those are the reps that will generally lead to greater hypertrophy. Okay, and this can be exercise specific as well. So I think that the effective reps concept lends itself better to isolation exercises than it does to multi-joint movements. With an isolation exercise, you've only got that one muscle generally experiencing most of the tension. Whereas if you're doing like a barbell squat, you've got your quads, you've got your glutes, you've got your erectors. Your quads may actually experience full motor unit recruitment and thus maximum stimulation at like maybe 3 to 4 reps in reserve as opposed to one. Okay, those additional reps that you do beyond that point, maybe your glutes, your erectors, other muscle groups kicking in and providing tension to get you through. So changing or modulating the effective reps in the follicular phase, I found to be a great way of not having to overhaul the training program, but providing that additional stimulation which the client may need because they may not be able to obtain it in coming weeks when they're feeling pretty crap. Okay, so that's one strategy that I have used in the past, which I feel is quite practical. It's very, and this is the thing, we have to find that balance between what's optimal and what's practical. And this is a very practical strategy that you can put into place that is quite easy to implement in a training program. You're not overhauling the program. You're not adding in heaps of sets, changing exercises and things like that. You're just making a minor change to the intensity that the client is training at, and that should have some benefits on the response, on the training response. And the important thing to understand here as well is that you probably shouldn't as a coach, and it's important to tell your clients this as well, you probably shouldn't expect or assume that your client is going to feel these negative complications at any time point throughout the month. I think it's best that you just anticipate it. And it's important to make the distinction between expecting and assuming and just anticipating. Okay. Like I said, there's lots of variance that can be observed within when it comes to these complications, not only from female to female, but within the female herself. So some of my clients who experience, quite aggressive, I guess you could say, PMS symptoms, 1 month they may experience them, really bad, and the month after it may actually not be that bad at all. So I don't necessarily expect these things to pop up. I just anticipate them, which means I understand that they could arise. And I know that I may have to make changes to the training program if that is the case. Okay? And as a female who, takes it upon herself to train and potentially coaches herself, doesn't have a coach, you don't want to be waking up every day or waking up when, luteal phase comes around and telling yourself that, when I go into the gym today, my performance is going to drop because the luteal phase has come about. You don't want to get into that mindset. Like I said, it's probably best that you just anticipate it and make changes on an as needs basis. Okay. If these complications don't arise, then you just don't need to make any major changes essentially to the training program, especially if you're programming, mesocycle to mesocycle.
Cool. That's fascinating. So, and then with this, because the thing that I still definitely have some confusion around is like with this, right? Let's say we know when they perform best and we know when they perform worst. And this generally for this person, let's say, we generally can anticipate this time of the month, they're generally not going to perform the best. And then at this time, they're probably going to perform better. How do we set that up in terms of like a mesocycle structure, given that the menstrual cycle is roughly 28 days with some variance? Because it's like, a deload is like a week or so, depending. And then your whole mesocycle, I guess if we include the deload, is it like, do we look at like a 4-week structure, or does it just change, or how does that work generally over time?
Yeah, and that's where it gets hard. And I've seen people promote certain strategies like, the first half of the month or the first half of the menstrual cycle, you should be using really heavy loads. Second half, you should deload, you should pull back, you should, drop all your intensities because progesterone is high. I think signing yourself up for that type of a programming strategy probably has many drawbacks in the long run, because you're giving up a lot of time that could be used productively in that second half of the phase, because those complications don't always warrant major changes or any changes to the program. So when I'm programming for a female client, I'm tracking the menstrual cycle quite basically on an Excel spreadsheet in some cases. In some cases, I don't do that because I don't feel like the client needs to. Like I mentioned earlier, if the client doesn't present with any, PMS symptoms, then we're all good to go and we can program as we usually would. But if you do have those clients that probably need that additional attention, then I program a mesocycle as I usually would. If I'm writing a program and it's week 1, I'll make sure to check the menstrual cycle and see how things align. And the things that I would stay away from or would ensure that I don't end up doing is, for example, if week 6 is coming about, and week 6 is generally that hard week of the program, and they're due for their period, that's when I start to potentially be a bit more conservative with the way I update their program, because I update my clients' programs on a weekly basis to ensure I can auto-regulate when necessary. And that's really handy, because being reactive about these strategies, I think can go a long way. I think has benefits over a more proactive strategy in this sense, because with the proactive strategy, you sign yourself up to 4 or so weeks of training, and if you're not going to change it just because it's written on a piece of paper, you don't want that. You want to be able to mold your program into what the client is currently experiencing. So I just be sure not to program super hard weeks of training when the client is experiencing PMS symptoms. If a client is going through a strength phase, I'd make sure to align the latter weeks of the training program when the load is really high with the follicular phase, if possible. Like I definitely wouldn't program a 1 rep max testing day during the late luteal phase or in menses. I think there's lots of drawbacks to that, and I think it's not very hard to look at the menstrual cycle tracker and just align your training weeks with the appropriate times throughout the menstrual cycle. Obviously it's very hard to set up a mesocycle each time based on the menstrual cycle. But with auto regulation, you really are able to make these minor changes when necessary and account for whatever the client is experiencing. So just to answer your question in a straightforward way, when creating a mesocycle for a female client, I'll just do it just like I always would for a male client. But again, I'm anticipating changes, and I've got no issues with auto-regulating the plan week to week based on where we are in the menstrual cycle. Okay, and there's those few considerations I mentioned earlier, like making sure hard training isn't occurring when a client's experiencing PMS, making sure we're not doing any super heavy lifting during PMS as well. Those are some of the true, I guess, like big rocks here. You wouldn't want to be doing that. And if you have no understanding of what happens within a female's body, then it's very hard to fall into the trap of just programming as you usually would, and then actually running into these issues. I know this is something that I've faced in the past when I took a more proactive approach, and I'd have clients complaining to me that they're feeling super fatigued, they're not recovering, they just feel wrecked because I've programmed like a week, hard week of training during a period of time when it's really probably not conducive to that style of training. So I think that's a major takeaway here. Being willing to auto-regulate the plan when necessary, but just creating your mesocycle as you usually would, and not making too many changes to your main philosophy when it comes to the creation of the program.
Would you say a lot of that sort of auto-regulation occurs by sort of just feedback from the client? Like it's usually sort of the client saying,
yeah,
I feel wrecked, I feel this, or is it sort of other measures? Or
Yeah, so I definitely use feedback quite a lot. And I think feedback is super important. So, I see coaching as a collaborative approach. I think updating a client's training program weekly is like a game changer. And I use feedback to do that. I've got several like rating systems that I use, for example, like mood, energy, sleep, hunger. All these things go into play when I'm updating a client's program. Also, as I'm looking through the menstrual cycle tracker, I'm using that as well. So I've got a lot of, I guess, signals that I'm looking out for. But when you understand the underlying theoretical mechanisms that are at play here, you can, like I said earlier, modulate training variables a little further without the feedback. So for example, in the follicular phase, if things line up really well, then I'm happy to push intensity that little bit further to try and make the most of the potentially improved training response in that period of the month. And that's why I think understanding the theory is important. Having that just basic understanding of what is happening within the female's body throughout the month, and then using her feedback to guide your decisions as well. So I'm using several avenues here to come to a decision, to inform my decisions. So yeah, I hope that makes sense.
Yeah, no, that definitely makes sense. Yeah, I think because it's one of those things where I think like programming for it is like, as someone who I've only ever had one female client.
Right.
So,
okay.
And I'm 21, so my experience with females is still
a long way to go.
Yeah, so I am still a young man with limited experience with females. So
yeah.
Yeah, I think
you've got a girlfriend, don't you?
No, I did. Yes, that is now over.
Okay. Sorry to hear.
So if there's any females listening, no, I'm just kidding. So yeah, I think programming for it is like, it's tough because it's, especially probably when inexperienced in it, right? It's like kind of hard to gauge like how the
Yes.
magnitude and
Yep.
and then even when to do it and then auto regulation of it. It's
Yep.
like, it's definitely complex, I think. Do you think so in terms of like, actually say like you're a relatively new coach like myself, and then you get a female client, and you realize this is a problem that you should probably tackle. How do you begin to tackle it with a client? Like, do you just have the conversation, or how do you say it? Because it can be a relatively awkward subject,
Yeah,
especially
of
if you're a
course.
male talking to a female. And
Yeah.
yeah,
Yeah, like that's where experience is obviously super important. We know that, over time, the more female clients you work with, the better you'll get at all of these things. And you build that coach's intuition, which I think is important. But then you're better able to overlay it with all those other avenues that I spoke about earlier, and making sure you're using several different signals to come to a decision. I think early on in a coach's career, they're very prone to just using like that one data point to come
yeah,
to a decision. You probably faced that. I faced that in the past. As I've gotten more experience, I've gotten so much more efficient at using several different data points and then coming to a decision in a quite a time efficient manner. When you first start working with a client, especially if it's a female, I wouldn't worry too much about these differences in the early stages. I think the best way to approach this would be to observe patterns over time. Okay, so program as you usually would, track her menstrual cycle if possible. I know it can be an awkward conversation, but actually, if you're actually able to bring it up and speak about it, the female will feel like she is receiving a more personalized service if you're able to do it in a manner that showcases that, and framing it in a way that shows the client that this will be so beneficial to her as an individual, because your service is now being increasingly tailored to her needs, which are different to any other female's needs as well. Like I said, we're worried about the individual female, not just averages. So I think observing patterns over time is really important. Then once you've got sufficient data, and remember, a couple of weeks of data is just not enough. You've got to try and get to the point where you show the client that you're in this for the long run, and you guys are going to need to work with each other for subsequent months before the program has actually gotten to the point where it's super specific and tailored to the client. I think a lot of clients go into a coaching process. They hire a coach and they think that off the bat the program is going to be super tailored to them. And like, obviously the coach is always going to try and tailor the program to a new client. But if you don't know the client, if you've never had any experience with them, in many cases you're just making educated guesses. Like, would you agree with me?
Yeah, 100%. Like, and I feel like that goes for a lot of programming. It's like, any avenue of it, it's like the first program you write for a client cannot be perfect. Like, it's not nowhere near optimal, or it might be, but it's a guess or a chance.
And that is something that I have mentioned to many new clients of mine, in recent months, years. I make sure I stress that this first program is just if we're trying to build a foundation here. I'm not sure how you're going to respond. This is like an educated guess on my behalf. As we start to string, several mesocycles together, I'll get a better idea of where you're at, how you respond, how your menstrual cycle may potentially affect your training and nutrition. And that's when we'll start to really tailor our strategies to your specific, physiology. So yeah, I wouldn't, if I was a new coach, getting into this with little experience working with female clients, I still think it's super important that you grasp these concepts and you understand that there is a difference, but you should know when to play your cards. Like, you do need to play your cards right. And observing patterns and trends, I think, is probably of increasing importance in those early stages. And then you can move on to further tailoring the program to the specific client and her menstrual cycle if need be. And just on that as well, like, I was programming for a female client the other day, and I named the program Phase 19. So I've been working with her for like over 2 years now. She competed last year. This is a client who doesn't present with many complications throughout her menstrual cycle. And although that's the case, there are still times when she might, message me here and there and mention that she's feeling pretty clumsy today, or just energy is low and it's coinciding with the period of menses. And that's when I just jump in and make changes to the program on a as needs basis. And I've gotten to the point where when I program for her, I know exactly what she needs. I'm very familiar with how she responds to training, with her, lifestyle and how conducive it is to training. But the thing is, I wouldn't have gotten to that point if I didn't stress the importance of just a long-term approach early on, and the importance of, continuing to personalize the service as each month goes by with your client. That the service should become more personalized as the months go by, because you get to know the client more and you just get a better understanding of where they're at and how they respond, like I said.
Yeah, that's what I've noticed with one of my clients I've been working for now for a year, which is pretty insane to me. And it's like,
it's a long time.
Yeah, it's like you begin to learn. It's cool. It's crazy. Like I didn't expect it when I first started coaching. Like, damn, you actually get to know these people. Like, it's not like, oh, you do their 100%. Programming and they get jacked. Like, it's like, no, you actually get to know them as humans, which is pretty cool. 100%. And then you get to know their biofeedback and all that, blah blah blah. And it's cool. One question that's on my mind, that I somewhat outside of the topic, but I also do think it's relevant, and I think it's something that is on the top of a lot of people's mind right now. Let me know how you feel about this question. Do you personally find that, given this whole situation where we have to modify programming sometimes for on the menstrual cycle, do you find when it comes to adding sets and changing total set volume rather than volume load, do you find that becomes frequently it is more disruptive compared to other progression methods when it comes to someone's, like, for instance, someone's recovery will undulate quite a lot when they're a female. Like, it'll undulate a lot more likely than a male in some cases. But do you find the set progression or large variances in set numbers over the mesocycle can be a limiting factor in this case? I guess maybe the phrase neurobiological backdrop, which I think Aaron told me about, is maybe useful here. Does that make sense?
Yeah, it does. That's always a tricky question to attack, because there's so many, I guess, avenues we could go through with this type of a question. Obviously, set progression has its place. Progressing in volume load has its place. When we're thinking about the goal of hypertrophy, we do need to understand that it isn't a performance adaptation. I think a lot of coaches in general, have this misconception when it comes to progressive overload and hypertrophy, where they think that, literally every week something needs to be progressing for hypertrophy to be occurring. Like, it's so common. It is I think a very common misconception.
Yeah,
and
100%.
All we need for hypertrophy is to go into the gym, make sure that we are obtaining a mechanical stimulus that is within that adaptive threshold. So it's overloading. And because our neurological backdrop, which, for people listening, that would just be the variances in, your body's internal state, which literally change from day to day based on a whole host of factors. Because that backdrop changes day to day, week to week, it's very hard to literally progress every single exercise in every single workout of the week from week to week. And you do have to accept that at times, not progressing an exercise may actually be best, because of the downstream effects that it can then have on other things like fatigue, which can then, which can be of detriment to the response you obtain from that session. So when I'm programming for a client, I will add sets again on a as needs basis. So, my personal philosophy for programming is making sure that we see progression throughout a mesocycle. Over time we do need to see progression. I said earlier, it doesn't have to happen from week to week, but over time we are after progression. And that progression, if the goal is hypertrophy, should be coming from the fact that the client is adapting to the sessions. Adaptation is a good thing. So on that topic, a lot of people speak about adapting like it's a bad thing. Like they say, when you adapt to a program, you should change it. That I think that comes from an incorrect understanding about the term adaptation.
Yeah.
The adaptation is what we're after. When we stop adapting to something, that's when we change it, not when we adapt to it. So the adaptations that you acquire from a training session when the goal is hypertrophy should result in increased muscle size, which would then theoretically mean that you have more contractile capabilities, which means that you should be able to push more weight, right? So the progression should be coming from the fact that your training is overloading enough to cause a response that leads to muscle growth and thus strength, if that makes sense.
Yeah.
So I feel like, progressing volume load is a great way of doing so without running into many of the drawbacks that can arise when adding in sets. However, in saying that, I think that, sometimes you get to a point where progressing volume load is essentially not possible in certain exercises.
Yeah.
And that's when you may be warranted with an increase in the number of sets that the client is doing. Also, if the client is currently prioritizing a certain muscle group, well, that's when sets come into play even further. I may be more inclined to add sets to a client's prioritized or muscle group that we are specializing. So it's a very hard question to answer in a straightforward manner. That's my general philosophy, if that makes sense.
Yeah, no, I think that gives a really good outline, because I think, yes, there is I spoke to Mike this morning, and it's like there's a lot of not controversy, but there's a lot of it's hard to understand, I think, and I think that gives a good outline, because it's like, okay, we outlined a bunch of stuff about menstrual cycle, right? And then here's how we adapt it, right? Here's how we change it in this specific situation. So I think it gives people quite a nice understanding of it, I think.
An overview. A nice overview.
Yeah. And I think no matter what, these kind of topics like set progression and all that, I don't know. We won't answer that anytime soon.
I don't think there is an answer.
Yeah.
I think I find it hard to think of a strategy. I find it hard to think that one solely using one method would be better than using both at the same time, if that makes sense.
100%. Like, there's probably situations.
So yes, 100%. Like, for example, at the start of a mesocycle, if you look at a mesocycle I program for my client, usually the first half consists of more set progression than the second half does. And that's just a natural progression from deloading, getting to the point where I've established a sufficient volume, which I think is adequate for the client in this training phase to produce the results we're after. And then if we don't need to push sets any further than that, based on historical data and based on the way they've adapted to this amount of sets before, well, I'm not going to add additional sets in an unwarranted manner, like I mentioned earlier. That's when I'll then progress volume load, unless a situation arises where, we're focusing on this muscle, so we'll add in another set, or we can't progress volume load any further, so we'll add another set then.
Yeah. I'm sorry, I just got lost thinking about it. It's very cool how a conversation can be so in depth, but I do think it's understandable. I at least hope. And I think it's very cool. I think it'd be cool to finish off by touching a little bit on relative energy deficiency syndrome, to the
Yeah.
degree to which we're comfortable talking about it.
Yeah.
Would you
Yeah.
be able
Fair
to
enough.
outline like what that is, and then
Yeah.
like how you notice it within clients, or how you kind of say like,
Yeah.
oh, okay, this is where we need to be skeptical or cautious, maybe?
Right. You're right. So the relative energy deficiency syndrome, I guess you could say, was formerly known as the female athlete triad, or at least we could say it evolved from the female athlete triad. For those who don't know what I'm speaking of, because it is somewhat of a topic of the past now, the female athlete triad was um, essentially comprised three different factors. Okay, and these factors could arise, or these complications could arise, if a client was in what we could say a state of negative energy availability. Okay, which would be menstrual cycle dysfunction. That would be one factor of the triad. The second factor would be a decrease in bone mineral density, and then the third factor would be the potential for an eating disorder to arise. So that was a female athlete triad, which was obviously tailored towards females. You know, it's in the name, and it was that's what we observed in females quite commonly. As research progressed, though, thanks to people like Louise Burke, who has done a lot of research in this area, we started to notice that these complications also started to arise in males when they were going through periods of negative energy availability. Obviously, a male doesn't have a menstrual cycle to lose, but there were other factors, other systems in the body that were experiencing perturbation, so changes in hormones, changes in their normal functioning, because a lack of energy, because of a lack of energy, quite simply. And when it comes to energy availability itself, what this is referring to, again, for people who don't know, is if we were to take the amount of calories that we were consuming and subtract the amount of calories we were expending from exercise, okay, exercise alone, not total daily energy expenditure, if that the result of that equation was negative, then we would be in a state of negative energy availability, because the amount of activity that we were doing was not being fueled by the amount of food that we were consuming. And thus, in that case, the body would have to prioritize processes that were of highest order, and would then need to blunt processes in the body that it didn't require, essentially processes that were energy expensive. The menstrual cycle is obviously one of those processes, and that's why we see menstrual cycle dysfunction occur when a female is doing a high amount of exercise activity and not eating enough to fuel those demands, and then fuel the other processes in her body that are required. Now,
Just to
yeah,
note there, when
yep,
it's is it kind of like it's a very severe deficit? Would that be a way to look at it, kind of, or like it's
yeah,
low energy availability? It
mm,
usually arises from high activity, low
yes,
intake. Would that be generally the main
yeah.
way?
So you could, yeah, if you wanted to put it simply, it would be due to doing a high amount of exercise over a prolonged period of time, and just not eating enough food to
Yeah,
fuel those activities, and that's
yeah.
where those complications start to arise. And
Mm,
like I said earlier, we have now observed this also in males. But it is more prominent in females.
mm,
There's probably a multitude of reasons as to why that may be the case outside of the scope of this discussion.
mm,
But when it comes to females, it is, I feel, something that many tend to disregard, and it should be like something that isn't disregarded. Like, you should try and fix the issue if it does arise, because there are long-term implications of experiencing amenorrhea, which is the loss of menstrual cycle. Um, and when it comes to fixing these issues, or transitioning back to a state where things are normal again, just like I mentioned earlier, there is so much variance in, like, menstrual cycle stuff. The same thing occurs when it comes to um, getting yourself back to a point that where things are at normal. So getting yourself out of amenorrhea, like research shows that some females struggle to get their period back. Some females don't get their period back. Others get it back a lot faster upon returning to a state of positive energy availability. And that really is the only way, or at least we could say the primary way of getting the body back to a point where it is functioning as it should. So
Do you feel as
returning
though,
to a
like,
state of, yeah.
is that kind of because like when I've not anytime recently I can really recall, but when I've had conversations with people about this in the past, it seems as though they, like, people will sort of talk about, there's one person in particular I can think of where they talked about kind of, and they were quite well educated, but they kind of had this misconception that it was just like, oh, I've just struggled with it my whole life, I don't know how to fix it. And it's like, but they weren't doing the one thing. And it's like, does it feel as though, is it usually, like, since it's usually caused by that, it's not like this is the only solution, but it's like, if you don't get rid of the cause.
100%. So, and yeah, a lot of people would be reluctant to get themselves back into a state of positive energy availability because of the potential weight gain that can occur with that, right? So I feel like that's why many individuals, particularly females, would be reluctant to try and attack this issue, because they know the potential weight gain that can arise from eating more food, essentially. So like I said, though, that has, negative consequences on bone mineral density in the long run. Hormone, estrogen and progesterone are essentially non-existent. They're very, very low during periods of time when amenorrhea is present. And like I said, if an individual is in this state, then it is in their best interest to return to a state of positive energy balance as soon as possible. If they want things to return to normal, that's obviously an individual, individual decision to come to, but that's what I would recommend.
Yeah, it's one of those topics where I think for me, it's like, it's probably one, and I'm sure you would agree, it's like, it's kind of similar, kind of the opposite, but similar to obesity, where it's like, fixing it is like, okay, it's a relatively simple solution in some cases, right? But it's like
we know how to fix it.
Yeah, but it's like getting there is probably a lot harder.
It's a different story. 100%.
Yeah. Do you, when you recognize that in clients, or you recognize something similar in clients, and I think we've probably learned good lessons from bodybuilding in this case, because it's like, well, it's
100%.
probably very, very common there.
Yeah.
Do you how do you go about tackling this as a coach? Like, do you refer out, or do you just sort of slowly encourage sort of a little bit more eating habits, or?
Yeah, interesting. That's a great question. So I have had, again, a handful of clients who, I'm still coaching right now, who have experienced that before. Generally, they are younger females. Amenorrhea is more prevalent in younger females. So technically, you are more at risk or susceptible to experiencing amenorrhea under the reproductive age of 14. Okay, so biological age being your current lifespan, reproductive age is how long since you started menstruating. So I have faced this with clients in the past, and generally speaking to them about the long-term consequences, in a manner that isn't going to cause any psychological anguish, I think is really important. And again, that comes with experience. This is something that I wasn't very good at in the early stages of my career. And I have taken some females through periods where I think they are in a positive energy available state, and it has paid off, and we have seen like the return of the menstrual cycle. In other cases, and there's one particular client who I still work with, we were in a calorie surplus for an extended period of time, and I know we were in a calorie surplus because the client was gaining weight, right? And we didn't see the return of the menstrual cycle, and that is when I think referring me out would be in your best interest as a coach. And don't get me wrong, I still referred out in the early stages as well, but really there is not much a gynecologist can do.
Yeah.
For example, like in this case, all the client was told to do was get a blood test, make sure everything was fine, and then she ended up getting told that she just needs to wait it out and eat more, train less, like I mentioned earlier, and hopefully it would return back to normal. So yeah, from my experience, referring out, I guess, is obviously something you have to do as a coach. But then if you really are, I guess, willing to help the client through this process, then like I said, it needs to be a collaborative approach, and she needs to be willing to do the same, if that makes sense. Like you do have to be on the same page here. And weight gain, like I said, is just a part of that process. So the client does need to be willing to get to the point where her weight increases, because that's just a byproduct of eating more food, right? And being in a surplus.
Yeah, exactly. I think it seems like it's one of those issues where this is where I'm glad like the educated individuals exist in this industry, because it's like it seems like a tough issue to handle, and it seems like it could be easily mishandled. As with many issues, obviously, whenever there's any kind of psychological tie to it.
Right.
And yeah, it's. I think I am nervous for the day that I have to try and help clients with these problems, but I am glad that I have some, at least, of the prerequisite knowledge to do so.
Well, the way I usually attack it, sorry to jump in there, is to, like I said, just explain the benefits, explain that it is important you also seek out like a medical professional who,
that usually a GP or doctor or
who is an expert in this area, and we will then use their recommendations to tailor our approach, because I would always take the medical practitioner's opinion into account and prioritize it, and then if the opinion that they have is to just let time do its thing, well, then that's where I come in and say, okay, well, based on that, it's probably best that we do try and reduce your activity level, or eat more food, or do both. Obviously this depends on the severity of the situation, and usually the severity of the, I guess, dysfunction, you could say, that the client is experiencing and how long they've experienced that for ties into how long it may take for them to get back to where they should be. Right. So for example, if you've had amenorrhea for a year, it's probably not going to take you a month to get it back. It's probably going to take you close to a year. Again, there's lots of variance that exists when it comes to that, but the research shows that the more severe it has been, the longer it's probably going to take to recover. Right. And in saying that, there is one like case study off the top of my head where a female bodybuilder lost her menstrual cycle in the first month of contest prep, but it took her 71 weeks to regain it, right? So we're talking over a year, and she would have lost it for a few months in the contest prep. So again, we just don't know what is happening inside the body. Physiology is so complex, but our best bet is to use, what the research currently tells us about all this, and that is that energy availability is the primary driver. And there are lots of, people out there who promote certain I don't want to say gimmicks, but certain strategies that just don't have the evidence base. And when compared to energy availability, are like a pebble versus like a boulder, right? Like we know we need to be in this position to get things back to where they were beforehand. And this little pebble over here, we just don't even know if that's going to have an effect. And what about the psychological stress that may come along with having to now stay on top of this little pebble?
I think you do want to call them gimmicks.
Yeah, okay, I do want to call them gimmicks.
I think it's
You know what I mean by that, though? Like the psychological stress that accompanies having to now take into account all these other little things.
Yeah.
Whereas we just probably should just focus on this big picture, because stress also plays a role.
I feel the exact same when people talk about foot biomechanics. It's like,
right.
Think about all this shit that just doesn't matter at all. And it's like, okay, cool. But I feel like it's anytime people can sell a product or something, there's going to be something
Right. Yeah, like
that
that
is
pop up.
subpar, some
Yeah.
gimmicks. um,
Yeah.
is there anything you would like to outline or particularly make clear before we finish off? Anything like, anything you'd like to restate or make sure is clear or anything like that?
Yeah. So I think I'd just give some advice to coaches who are relatively new to the industry, working with clients and wanting to get to the point where they are coaching, female athletes down the track. It is important to understand that, differences between men and women are a thing. Okay. You shouldn't treat a female client exactly the same way you would treat a male. But in saying that, in the early stages of your career, when you are just starting out with females, it's probably best that you practice applying the training and nutrition principles, making sure you're doing a really good job of that, building your own programming philosophy, and trying not to get caught up into the discourse pertaining, set volume, volume load. Like, build your own philosophy based on all those concepts, but make sure it's not so regimented to the point where it isn't moldable in the future, because you will get to a point where you are working with some advanced female clients, hopefully, which would then pay you and would benefit you to further personalize their programming in an effort to produce even better results. So that's the natural progression of a coach, right? You start working with more advanced clients as you go on, and that's where your knowledge needs to be, up to standard, so that your clients understand and can see that you are prioritizing them as a client, and you're prioritizing, the differences that may be present between them and everyone else, essentially. So I think, it's just important to expose yourself to, the physiology, the theoretical mechanisms, keep them in mind. Like I mentioned earlier in the podcast, looking out for patterns and trends and trying to make this association with what we see in the research, using your critical eye and what you see in individual clients, and then using both of those avenues to inform your decisions. And like I said, molding things into your philosophy as opposed to overhauling your philosophy, because I've seen that before. Like, I feel like I mentioned that earlier. We can't just change things completely just because we're coaching a female. We just need to be a little bit smarter about the way we go about things, and, changing the plan if necessary on an as needs basis has its benefits.
Yeah, I completely agree. And I think like you guys over at JPS do a fantastic job of like actually doing that, like doing the whole thing where instead of just kind of rigidly following X person, it's like here's an integration of like everyone in the industry. It's like pretty damn crucial. That's what I'm striving to do as well. We'll see how we go though.
Awesome. Yeah.
So if people are they able to purchase like a replay of this at all, or are they able to?
Yeah. So if you wanted to get your hands on more content relating to what we've spoken about today, the JPS Health and Fitness website is the best place to start. We've got a bunch of products online, a bunch of seminars you can purchase, and one of them is the Female Fat Loss and Physiology lecture that I hosted a couple of weeks back. So that's always available online. And we've also released a new education portal, which is also available on that. That's only $5 a week. So how many other things you can buy for $5 a week? It's like you can buy a cup of coffee, you can buy a pack of toilet paper for $5.
Maybe not right now though.
Yeah, maybe not right now, especially in Melbourne. I've got to get to the shops like ASAP because lockdown starts tonight, and I need a few things. So I should probably do that.
And where can people find you online if they're looking for you specifically, if they want to interact with you?
Yeah, so my Instagram handle, which is still Mr. Fitness with a _, and the JPS Education Instagram page as well. That's your best bet.
Cool. Beautiful. I think you should change it to Martin Refalo, but it's whatever. Hey guys, so we'd just like to say thank you so much for listening to this episode of the Hypertrophy Hub podcast. If you did want to help out the podcast at all, the best way to do that would be to either you could support me on Instagram, so you could follow me on Instagram, interact with my content over there, Or you could go and leave me a review on iTunes. That is probably the biggest thing that you could do. One, it gives me feedback, but secondly, it also helps me to improve the quality of the show and basically make my show a little bit better. So if you did have any feedback, please send it to me on Instagram or leave a review on iTunes. 5 stars is preferred. However, if you genuinely did not like the show, feel free to leave any rating you like and any sort of feedback you like. I want to make the show better because it's all about learning. So I hope you guys enjoyed the show, and I'd like to say thank you very much for listening.